lives we've lost and for the families they leave behind. Thank you. Now we will hear updates from our community leaders, and first we'll hear from City of Albany Mayor Bo Durrell. Mr. Mayor.
Thank you, Chief. I don't have anything much to say today. I was listening to something on NPR yesterday, and there was an expert. He was opining that I think the death toll would, in his opinion, by the end of September be 200,000, and through the winter, unless there's a vaccine, it could be 400,000, even if you see the incremental increase that we're seeing throughout the country. The point I'm making here is we need to understand this fight is not over. And in the coming weeks, we've had discussions. The city will be partially opening up city buildings. City and county officials will be back at work, subject to modifications. It's my understanding that one youth organization will have a baseball season this summer. But those contests and the season will be contingent upon the league complying with guidelines, which will make youth baseball different than anything you've ever seen before. You'll have to maintain social distance. Probably some parents will have staggered invitations to the games. We are seeing our churches in preparation. Some will have in-service this weekend. Most other churches will be having in-service beginning next weekend. I am frankly impressed in our discussions with clergy as to the precautions that many churches will be taking. And Dr. Black, if somebody get Dr. Black in, I just want to say, things have come out during these conversations. It is now understood that individuals in choirs can easily infect each other, not only because they're in close proximity, but because when singing, you're projecting your voice. And we know from the research that COVID-19 is usually contagious. It's person-to-person transmission. That is why maintaining social distance in the months to come is so very important. Continuing to wear a mask in public. We can see folks who say, I'm not going to wear a mask. This is all ridiculous. This is scare tactics. Again, some folks have the attitude, don't confuse me with the facts, I got my mind made up. It appears to be, and we'll let Dr. Ruiz and Dr. Black speak to it, but I don't think there's any question in the medical literature that wearing a mask is the prudent thing to do. It protects other people, again, from the respiratory droplets that are projected when we speak, when we sneeze, when we cough. So in wearing a mask, we protect other people. But also, there's literature that says if you have one of these 3-layered masks, it protects you. But be that as it may, please, please continue to wear a mask in the coming months. We also want to remind you the hygiene precaution: wash your hands repeatedly throughout the day with warm water and soap. And if I could ask, again, for those of you who have not been tested, please, please take advantage of this opportunity. And I say this on a conference call earlier this week. Dr. Toomey, Director of Department of Public Health, was talking about several things. And one thing she was talking about was how to reduce transmission. She said what we've seen in the last 2 months since shelter in place was implemented throughout the country, most of the transmission has been from people who are in close proximity to one another. Individuals who live in congregate settings, such as nursing homes, family-to-family members, and also people who work in close proximity, such as some of these meat plants where we've seen. Also, there are problems being transmitted, and this was discussed, from people who are migrant workers, who are moving from state to state. And I say this because, getting back to the first issue, we are not through this. This expert yesterday opined that unless there is a vaccine, by the end of the winter, at the rate we are going, 400,000 people will die from this virus. We're only a third of that number today, less than a third of that number today. We have made incredible progress here in Albany and Dougherty County, but we have to remain vigilant to protect our families, our friends, and ourselves. Thank you for your continued cooperation. Good day.
Thank you, Mr. Mayor, for your comments today. Next, we'll hear from Dougherty County Commission Chair Christopher Cohelas. Mr. Chairman.
Thank you, Chief. Thank you, Mayor. Today, I'm very proud to be here and to be talking about the positive developments that we have seen here in Dougherty County through a lot of hard work at the medical care level, at the first responder level, and at the community level, from churches to citizens to community members, moms, dads. Just good old-fashioned hard work has really gotten us here. And if you look at the chart and understand this, we have, and I want to thank the Dougherty County Emergency Management Agency and the many different parts that work there to be able to compile this data, because we have worked very hard to provide open and transparent data to the citizens as we have moved through this pandemic, which has been of epic proportions, not only on a global scale, but also on our community scale. And I really want to just say I'm thankful for where we're at. Because we have now, and I believe the coroner will report just one death in the past 14 days. And we actually went a period of time at the last report where we had no deaths for 8 days. And if you take and you cast your mind back to where we were with the rate of infection, the number of vulnerable people, the elderly, the medically fragile, the people that were absolutely the ones that we wanted to shelter in place, the ones that we needed to be protected. So many of those citizens were the ones that were passing away, and we have greatly halted those numbers. And the fact that we've only had one death in the past 14 days, and every death is too many. But we've made tremendous progress, and frankly, in comparison to many other communities around the state and the country and the world, we've done a phenomenal job, and we couldn't have done that unless we had hardworking medical care professionals, healthcare professionals, first responders, and community engagement. And I've said this before, I'm going to say this again. If you look around in our community at the level of engagement that we have and how we've taken up arms, taken up masks to actually protect ourselves and learn things like social distancing and apply that, we've done it far better than many other communities. I know that there are always going to be complaints that, so-and-so wasn't doing this or so-and-so wasn't doing that. But in reality, we had to learn a lot faster than many of these other communities around the state and around the country. And the fact that we're here and we continue to see the numbers flatten and we're testing as aggressively as we are, because understand this, the testing we have in our community is occurring and has occurred at multiple different levels that doesn't exist in other communities. We've been testing at Phoebe. We've been testing at the Department of Public Health. We were testing with the National Guard. We have private care providers that have been testing, and now we literally made it available for anyone that wants to get tested in this region. And so we're still testing that many people, and anybody and everybody, not just whether or not they're symptomatic, are capable of getting these results, and we're still seeing the numbers flatten. And one of the things that you're going to hear us continue to talk about, and it's a discussion that I anticipate we're going to have some results with respect to soon, is the antibody testing. It's something that the city and the county and the school system have been talking about. We've approached a partnership with Augusta University so that we can find out how many citizens within this community actually have the antibody. And there's a complicated process to that. I don't understand each and every one of the medical nuances, but the medical professionals from Augusta University have explained that the testing that they have available, that we are going to deploy on a cross-section of the community that is truly representative of the community in terms of demographics, race, age, and geographically across the entire community, so that we can understand where are we at in terms of reaching what some call herd immunity. And I think that's very important, because if you go around the state, some people think, oh my goodness, we shouldn't go to Albany, or we shouldn't go to Dougherty County because, you know, they had such a bad influx. Well, the reality is this: we withstood a tidal wave and we didn't fall down. We actually worked hard. We bunkered up, we hunkered down. And yes, we had a tremendous number of people that lost their lives. We had a tremendous number of people that were infected in a short period of time. And I've said this before, I'm going to continue to say this again. We can't live our lives completely gripped in fear, staying in our houses completely and locked up and shuttered away as if we're prisoners of our own fear and in our own homes. It's not sustainable for a society. It's not sustainable for our community. It's not sustainable for our children. Like, our community is going to have to tackle many of the same problems that other communities are going to have to tackle, and perhaps we're going to end up tackling them first. But it's not sustainable for children to not have an in-class learning experience at some point in time. It's not sustainable for them to lose all of those learning opportunities simply because we are living in fear. And the reality is this: we have worked very hard to flatten the curve. The things that have been proven to be effective: cleaning your hands, maintaining good hygiene, staying more than 6 feet away from each other. If you can't maintain social distancing, wearing a mask. And we've seen that happen. We've watched it mathematically, what it has done in our community. We've greatly reduced the overall infection rate. We've greatly reduced the number of people in our hospitals, greatly reduced the number of people on ventilators, and virtually eliminated, for the time being, the mortality rate. That's very, very critical. So if you can eliminate those outliers, then we have to then begin having the discussions on how we move forward. And where you're going to continue to see, as we move forward through this process, how we cultivate, how we tailor answers to how we move forward. So like one of those things, as you've heard, or perhaps you may or may not have heard, the city and the county have passed an ordinance so that if you're going to come into a city or county building, you're going to have to wear a mask. That's just good common sense. And I'll tell you this, I was very pleased. Yesterday I went to a retailer and I saw that retailer had a customer that came in and they didn't have a mask. And it was a smaller retailer. They said, "Excuse me, sir, I will provide you with a mask," so that he could keep his employees safe, other customers safe, and provide a better experience. These are the types of solutions we've been working through here, and frankly, have been on the forefront on these issues. We've received over 80,000 masks through participation with the governor's office and the Georgia Emergency Management Agency. We've deployed those across the community. We've made them available to citizens, to churches, to businesses, and have tried to make sure that they're out there in a part of the culture of our experience so that we can continue to do what we have been doing, which is lowering or reducing and mitigating what was initially a tremendous epidemic here in this community, and it continues to be a pandemic across the world. You're going to see different services that are coming back online. We're going to be opening the tax and tag office, and let me get the specific information on that. Tomorrow, the Dougherty County Tax and Tag Office will reopen to service customers with upcoming tag renewals. The office will serve customers by appointment only, and masks must be worn. To schedule an appointment between 8:30 and 5 o'clock, customers should call 229-431-3255. No cash will be accepted. That is to make things safer for them, make things safer for you. Customers should plan accordingly with check, money order, or credit debit cards to pay. Again, that is by appointment only between 8:30 and 5. The phone number to schedule an appointment is 229-431-3255. You're going to see other components or other government buildings that are going to be coming back online. And I want to say this, I'm very pleased to see that our restaurants and our retailers are back open. And I will tell you this, for those that would like to sort of badmouth Albany and Dougherty County, I would say this, I don't know that you can have a safer shopping experience in any other stores than those in this area. Frankly, to be honest with you, the precautions that have been taken by our retailers, our restaurateurs, our hoteliers, all of our merchants, and I know that there are some exceptions, but we've actually monitored and sent the sheriff's deputies out there, the police department, and monitored their literal compliance with the governor's orders, which is a level of enforcement that has not existed in any of the other surrounding counties, any of the other regional counties, and I'm not saying that to pick on them. We had to do this out of necessity, and we've done that, and we've instilled a culture of compliance and of cooperation, and it's been done with the benefit of the partnership of the Albany Area Chamber of Commerce, and our business community has done a fantastic job in providing a safe experience. I've had the opportunity now to dine out several times, and I've been very pleased to see the precautions that have been taken by those business owners in providing a safe experience. Making sure that the servers are wearing masks, the people are taking all the necessary steps to make everyone feel comfortable. And those are the steps that truly matter. And I'll say this, and I'll continue to say this, we cannot continue to live our lives in fear. We're going to have to work through this process, continue to social distance, continue to wash your hands, continue to wear a mask. But these are the steps that we're going to have to go through, because you can't shut down all of society indefinitely because of the fear of this particular pandemic. Again, you're going to also see, I believe, as of June 22nd, or June 20th, excuse me, all city and county buildings will be open, and that will be, if you're going to come into a city or county building, you will need to wear a mask. Again, I thank you all for your hard work, your cooperation, your prayers, and your vigilance. Please stay safe.
Thank you, Mr. Chairman. Next, we will hear from our representative from Phoebe Putney Memorial Hospital to provide an update. Dr. James Black is with us today. He's the chairman of the emergency department. Dr. Black.
Thank you. Good afternoon. I want to start off, I think we have our chart up, and we'll talk about that a little bit, but I would be remiss if I didn't take the opportunity to thank and to commend the citizens of Albany and Southwest Georgia. As you can see in our chart, for the last couple of weeks, we have had a census of the health system of less than 40 patients. Now, that's markedly down from, at our worst, we were above 200 patients, and we were transferring patients out. So we have vastly improved our stance as far as COVID is concerned. I would like to put out a word of caution. That number has not gone to zero. And if you look at the two charts, the bar graphs on the far right, this shows that we're still admitting 2 and 3 patients a day. And I know that number seems small, but I think back to the words of my dentist when I had my first cavity. He said, I'm going to fix this cavity for you. And I said, oh, I want to have one cavity. He said, but if you have one cavity for 32 years, you won't have any teeth. So the numbers add up. 2 and 3 is not zero. We're still having new cases. There are also, these are just the patients that were admitted to the hospital. We're still seeing several patients in the emergency department that are not sick enough to be admitted to the hospital, so several people are being sent home. We're also seeing patients in the community at the outlying clinics that are having positive cases. So coronavirus is still in our community. It is still possible for people to get sick. So now is not the time to ease up on our commitment to providing a safe environment for our community. As I stated before, we've done a great job, and you've heard the mayor and the chairman tell you all of the successes that we've had. But do realize that not only are we paying attention, but the state, the country, and the world are actually paying attention to things that we're doing here in Albany, Georgia. Several times weekly, or several times during a month, but at least weekly, I have conversations with people around the country and even overseas who are calling, asking us how we were able to manage this in Albany, Georgia. And I think you should kind of feel very proud of how we have responded as a community. But I do not miss an opportunity to tell people the only way we have been able to fight this off and to be as successful as we have is by the commitment of the people of this part of the state. So our civic leadership was immediately involved, and we're doing things before it became mandated by state and federal governments. We were taking drastic and aggressive actions in order to protect people. And the key to that is we can make all the mandates and suggestions, but if no one pays attention and adheres to that, then it's all for naught. So again, we have made these strides due to the commitment of the community. With that being said, we are not out of the woods. I know the weather is getting good and everybody would love to get outside the house and do some traveling. Do realize as our numbers have improved, there are several areas in this part of the state and around the state and even other states that are actually seeing an increase in their numbers of people. So when you think about traveling, do realize that this disease is everywhere and there are a lot of people who are sick and the other parts of the state and the country are not doing as well as we are. So you're still putting yourself at risk. As we talk about relaxing some of the restrictions that we've had on businesses, we're doing the same thing at the hospital. We're easing some of our visitation restrictions. Now, we're not going to go back full bore as we were at the beginning of March or late February before all of this started, but we're going to have a stepwise, thoughtful approach as to how we're going to increase our visitation of our loved ones in the hospital. Starting today, actually this is starting this morning, that all patients will be allowed one visitor per day during the hours of 9 a.m. to 7 p.m. Now, that one person can go and come as they choose, but we will only allow one person per patient. All visitors are going to be asked to enter and exit through the main entrance to the hospital. And we'll have security there. We'll have people logging who's there. You must wear a mask. If you do not have one, we will provide you with the mask. You do have access to the cafeteria concession areas, but we're going to ask you to limit your visitation to those areas or to the clinical ward where your loved one is. There will be some exceptions to this, but they're very specific, for instance, in labor and delivery and in the NICU and other certain exceptions. I do want to point out, though, there's one area that's not going to be open to visitation yet, and that is the emergency department. We are undergoing construction in order to help maintain some separation of those patients that are likely to have COVID from the rest of the population. But you can imagine if a patient shows up with 2 or 3 family members and they're in a waiting room, we're putting a bunch of people at risk. So we're not quite ready yet to open up visitation to the emergency department. We understand that everybody wants to spend time with their loved ones, but we're still very committed to the safety of our patients and to our faculty and staff that work in the hospital. So I want everybody to be thoughtful about their actions. I do want to impress upon you, treat everybody as though they're potentially sick. So I want you to wear your mask. I want you to wash your hands and sanitize things frequently. I want you to maintain your social distancing and make good choices. We're not out of the woods yet, but we're doing an awfully good job and we're heading in the right direction. Thank you.
Thank you, Dr. Black, for your report today. We will now hear from the Director of the Southwest Georgia District of the Department of Public Health, Dr. Charles Lewis.
Thank you, Chief Scott. Good afternoon, everyone. It's wonderful to be the bearer of good news. And when we take a look around us and we see so many of the numbers improving, there is objective and measurable evidence of good news. For instance, in Daugherty County, the number of new cases of COVID-19 has gone down. If we look at the last week of May and compare that to the first week of June, here in Daugherty County, there were 46 new cases of COVID-19 in the last week of May. For the first week of June, that number was 24. That's a reduction of 48% from one week to the next. And there are many ways of looking at that. Dr. Black has already talked about that to a degree, of the number of hospital admissions, the number of deaths, and so forth. In most cases, the numbers are going in the right direction. And those are just simple facts that we can enjoy. However, I want to follow that with some warnings. This pandemic persists. The COVID-19 pandemic is not over. People are still getting sick with COVID-19. People are still being hospitalized, and people are still dying as a result of COVID-19 infections. It is way too early to let our guard down. We need to be diligent so that we can continue to contain this virus until we reach a point where it's gone, or to a point where we have a vaccine, or both. We need to remember that our choices and our actions have consequences. And that's regardless of whether we are in our homes, or whether we're working, or shopping, or socializing, or worshiping, or mourning. The things that we do will have an impact on the health of ourselves, the health of our family, our friends, and our community. We don't have anything dramatic to share with you as far as new ways of controlling the virus, but we need to continue to talk about the importance of wearing masks, of social distancing, keeping our hands clean, whether it's soap and water or antiviral gel. We need to think of those things regardless of whether we're working or socializing or wherever we go. We need to remember that it is literally dangerous to shake hands, to hug people, and to kiss people. So as we move gradually more toward a normal style of living, we just cannot let our guard down. We've got to continue to be diligent. We've got to continue to recognize those simple things that we might have done in the past are now too dangerous to do. So we continue to test, and it has been proposed that a good benchmark for testing is each month to test 2% or more of the population. And here in Daugherty County and in the Southwest Georgia Health District, along with hospitals, private offices, and so forth, we have been able to test more than 2% of the population, and we want to keep that enthusiasm going. There are a number of opportunities for testing through the Department of Public Health. These tests cost nothing to the patient, and I'd like to mention some of the testing sites. To schedule an appointment, it's a simple thing to do. Call 229-352-6567. Currently, we have collection sites offered in 9 different counties, including Colquitt, Decatur, Daugherty, Grady, Lee, Mitchell, Terrell, Thomas, and Worth. Some of those are on a 5-day-a-week schedule. Some have actually been on a 6-day-a-week schedule. And the best way to find out where you can go for a convenient location is to simply call that number, and they can share the schedule with you. It does change from week to week, depending on what the needs are. And currently, we're also involved in a joint effort in Moultrie, Georgia, with the Colquitt Regional Medical Center. Public Health is there to assist them in their collections, and that effort will continue tomorrow and then again Sunday, and then public health will be performing collections at the Colquitt County Health Department from that day going forward. And again, the number is 229-352-6567. Operators are there until 5 every weekday and until 4 on Saturdays. And the last thing I want to talk about is the process by which infected people can safely come out of isolation and return to work. Early in the pandemic, it was believed that the wise thing to do for going back to work after an infection was to have 2 negative tests for COVID-19 before going back to work. But as more information has been gathered, as more research has been performed, the CDC has relaxed those guidelines. And so to come out of isolation and to return to work for a non-hospitalized case of COVID-19, it only requires 3 conditions be met. One of those is that 10 days or more have passed since the onset of the first symptom. The second one is that there have been 72 consecutive hours of no fever while the patient has not been taking fever-reducing medicine. And then the third one is that all of the COVID symptoms are improving. So based on CDC guidance, if these conditions have been met, then it is appropriate to come out of isolation and to return to work, even if the patient works in the healthcare field. So public health is here to help. One of our main focuses is the collection of samples to use for testing. Once people do test positive, public health is involved daily in contacting those people to educate them on what they need to do as far as isolation. From those people, we obtain a list of people who have likely been exposed. We have added on dozens of staff members who are engaged in making phone calls to those in the community who have been exposed to educate them on the process of quarantining and to monitor their symptoms. If education or if information is needed by the community concerning COVID-19, feel free to call your local health department. They will be happy to help you. Thank you.
Thank you, Dr. Ruiz, for your report today. We will now hear updates from Dougherty County Coroner, Mr. Michael Fowler.
Good afternoon. We want to go through, I cut some of my slides out. Dr. Ruiz said, Mr. Fowler, you hadn't been calling me lately. I said, that's a good thing. That means people have not been dying. So that was a good thing that things have changing. As of today, we have 150 deaths. From the last time I spoke to you, we had just 149, so we just have one more death that have happened. So what we did, instead of going through all the slides I usually go through, only thing changed from the last slide that we did on the breakdown, we have one more black female, a total of 61 black female. That's the only thing changed on the chart. The positive thing on our chart here, this is the most important chart. If you look at the last 6 weeks of our chart, you can see the numbers going down. The first 5 weeks, we was in 27, 26, 27. You see how high the number of the death rate. But last week, we had 0 death. That was a positive thing. Week 12, we had 0. No one died that particular week with COVID virus here in our community resident. As of from Sunday to now, we just have had 1 death in Dougherty County. You can see the trend is coming down, but like I said, 1 is still too many. But we want to encourage you, let's keep practicing doing what we did doing. There have been only 1 death in the last 14 days. In 14 days, 1 death. That's a positive note. I know Many things are opening up now. I get many phone calls, even this week, from some of the pastors and faith-based leaders. I'm a pastor myself, and I know we're concerned about whether to go in church, whether to not go in church, whether the funerals, we need to do funerals, all kinds of questions coming up. But I put out a few notes because we as pastors and faith-based leaders, we definitely want to be concerned about our congregation. And just there's been numerous of flyers out there for us protecting our congregation and what some of the things to do. But I just wanted to bring it back to your attention because I know this weekend some other churches will be opening up. And the following week, there will be other churches that open up. Put a flyer out there showing your community what you are doing to protect them before they come in. A good thing to do is check the temperature when they come into the door. If you have not ordered a temperature gauge, check everybody's temperature when they're coming in the door. Show them that you have placed tape on pews or seats 6 foot apart so you can show the usher can show the members where to sit. The ones that are sick, stay home. You want to get nobody else contagious with the virus. The one, wear gloves, especially the ones that can be counting money. Wear gloves. Another thing to do, encourage your congregation to get on social media, start using Giveify, the app that you can give with your phone, that you won't have to use cash money. But when you're using cash money, somebody need to count it, but please wear your gloves and use hand sanitizer. And I keep hand sanitizer in my pocket. So it's good to have it all the time. The ones that have the large congregation, it's good to divide the service up into smaller numbers. Clean your bathroom. No more people are going to be using the bathroom. A good thing to do to have the ushers or someone every periodical to go in there and wash the knobs that you cut the water on, the door handles, wash those things down or keep them sanitized because different ones are going into the restroom. And there goes some individual who not wash their hand even after they use the bathroom. So have somebody to keep cleaning that part of it. Same thing after the service, have a deep cleaning. There's different things that you can do. There's foam, different things people are using doing to clean the churches, the pews, the mics and stuff off. So do that. Wear masks, still wear masks. That's very important. No touching, hugging, kissing. Like I said, carry hand gel and provide hand gel to the ones that don't have it. It's good to have masks. If you don't, someone come to your church, you don't want to turn them away. We'd love for you to wear a mask in our congregation. So those things, if we keep doing that, after a while, you won't see me coming up here because we're going to have 0 death. That's what I'm pushing for, that we have 0 death. But I know we got to move the fear out of us. We got to get back into some kind of form of normalcy. I'm going out every day, but I'm getting to the point I can't see most of my friends and members in the church. It's almost depressing. And I can just imagine how some of the senior citizens are feeling, not able to get out. You got to sit home and watch Bonanza, cowboy movies all day long. I know that's probably depressing. They want to get out and do something. So I want to encourage them, let all of us keep doing what we're doing, that we can all eventually get back out and start practicing, start doing some kind of form of normalcy of what we want to do. I want to say again, let's be safe. Again, going into the churches, let's be safe. And don't fear because God is still in the midst. Thank you.
Thank you, Mr. Fowler. We will now pause for questions at this time. Okay, there's no questions today. I want to remind you again of the Emergency Operations Center for information on anything you've heard today, perhaps numbers that you've missed or information that you are trying to write down during the presentations today. You may call us at 229-302-1900. That's 302-1900. That number also should be used for any compliance issues or compliance reports you'd like to make. Please call that number. We're there 7 days a week from 8 a.m. to 5 p.m. Our next press conference, again, we've moved to one press conference a week. It will be next Thursday at 1 p.m. And as we end today, I'll do as I do every press conference. Mask up Albany, mask up Dougherty County. Thank you very much. Press conference ends.